All right. And thank you everyone for joining today. We're excited to have a big group today because we think this is really important. As many of you know, because it's probably why you're here, we were extremely fortunate this year in the West Virginia legislature to get our funding increased. And what that did was open up a lot of different positions or additions to existing positions for folks that get paid through partially through this money. So we wanted to have this orientation to get everyone together to try to basically a crash course, if you can think of it that way. So you can familiarize yourself with FRIS, what we do, our roles, where you can reach out for help, what you need to know about sexual assault services and all that, as much as we can cram in here. So this is definitely going to be a very fast paced sort of thing. We have people monitoring the chat. We love that there are so many cameras on, and we encourage you to leave your cameras on, especially when we get to the end or if you have questions, because we love seeing your faces. And as Nikki said, it is being recorded, so hopefully we'll have that in case you get new people moving forward.
We also want to take the opportunity to kind of have a meet and greet today, so you can meet most of the FRIS staff today. So for the next 2 hours, what you can expect is an introduction to our organization. So we do have a little over half of the folks who are a little bit more long-term advocates. We have some folks that are literally starting this week, and some about, probably 15 or 16 of you that have been at your agencies for under a year. So we're going to talk a little bit about some of our FRIS funded projects, and if you haven't already, meet those coordinators, some FRIS initiatives and collaborations. And I always forget to introduce myself. So I'm Nikki Godfrey, the Assistant State Coordinator at FRIS. Been here for almost 13 years and have worked a lot with SARTs and on prevention most recently. We're going to look at some of the resources that we have that hopefully if you need something, you know where to find them within FRIS. We're going to talk about sexual assault response teams, victim services and allied professionals, the technical assistance and training that we offer and collaborate with you all to do. We're going to talk a little bit about stalking, prevention, sexual assault nurse examiners, and then we're going to have a parking lot for questions that can't be answered quickly. So there are a lot of us here today, and each person is going to take about 10 minutes or so to do an overview of some of the work that they do, some of the initiatives that you can get involved with at FRIS. And you can ask questions along the way. You can use your chat, or you can unmute yourself if you would like. And if it's going to take a little bit longer than a minute to answer that question, we'll put it on the parking lot and we'll try to address that at the end, or if not, then we can connect with you individually after that. So some of the folks that can't be with us here today, Debbie's going to introduce the sexual assault nurse examiners that work with us, but also we have Nancy Hoffman, who is our state coordinator, and Stacy Farson, who is our finance manager. So these folks are really the ones that keep the engine going at FRIS and often behind the scenes, but we very much appreciate their work. Did I forget anything, Adrienne?
Nope, I don't think so.
Good afternoon, everyone. I am Brittany Scott with FRIS. Before I get into what I do, I'm going to give you a little bit of an overview of what FRIS does. So FRIS is the State Sexual Assault Coalition. We pass through state and federal funding to 12 rape crisis centers across the state. We do training for advocates, law enforcement, prosecutors, SANE nurses, basically anybody who will see a victim. We work on the state level to develop policies and laws. We develop resources. We sit in on several statewide boards and commissions. We do have a handout for you, and I think we did forget to mention that earlier. There are a couple of different handouts for you, and those will be put in a Dropbox link and sent to you. But one of the handouts kind of goes into a little bit more detail about the role that FRIS has versus what each crisis center does. To kind of summarize it up, you could think of you all as like the boots on the ground. FRIS is kind of behind the scenes, making sure you have the training and the resources, et cetera, to effectively provide those services. That handout also has all of FRIS's contact information in it. Back to me. I am the grant coordinator for 2 of FRIS's pass-through grants. State funding is one of them, and that is one that most, if not all of you, are partially funded under as of July 1. That grant is DHHR grant, and those funds are legislatively set aside specifically for sexual violence. Under that grant, you can do services, outreach, awareness, prevention, and trainings. The other grant that I coordinate is the SAS grant. That is the Sexual Assault Services Program. That is an OVW grant that is for direct services only. So there is no training, no prevention, anything like that. Regarding the different services and what you can and can't do under a particular grant, there is another handout that has a chart of all of FRIS's grants and the allowable and unallowable activities. That same handout also kind of gives you a brief overview of what advocacy looks like, the different activities that you may do, and it's broken down into categories. So you'll have awareness, outreach, prevention, training, and direct services. There's also a section on grant documentation, and that basically tells you how you should document your time. As a funder, we have to verify that the activities that are completed under a grant are allowable per their guidelines. So that is how we do that, by looking at the activity logs. There are also monthly progress reports where you'll document number of victims served, any trainings, awareness activities, outreach, etc. Those progress reports are usually agency specific. For SASP and state, each agency kind of gets like a menu of options that you can choose for your goals and objectives. So your director will probably give you those, but I also have access to them. That about wraps it up for me. If you have questions regarding SASP, state, allowable, unallowable activities, just let me know. Up next, we've got Adrian.
Hello, everyone. I am Adrienne Nichols, and I am the Victim Services Coordinator, or a Victim Services Coordinator here at FRIS. I've been with FRIS for almost exactly 3 years. Previous to coming to FRIS, I did a brief stint as a forensic interviewer at a CAC, and then I worked for 9 years at a dual agency, Hope Incorporated, dual agency, domestic violence agency, and rape crisis center. One thing that you'll notice about my position compared to my co-workers here today is that a lot of their grants coordinate specific projects. So for example, if you are on Marcia's grant, the Rural SART Coordinator grant, then you would go to Marcia. Whereas my role, I can kind of work with more variety of different people. Next slide, please. So one of the things that I wanted to explain today was the definition of technical assistance, because technical assistance is one of the things that FRIS does, maybe one of our biggest roles that we play. Technical assistance is simply helping people have the information and resources they need to serve and be accountable to survivors of sexual violence. West Virginia FRIS defines it as direct problem solving and support services. I like to kind of refer to it as phone a friend, if you think of it in terms of that. TA, as we call it for short, technical assistance. TA can be talking out complex situations, or it can be providing in-person direct support, whatever's needed to accomplish the goal. Each presenter today, each of my coworkers will give you some examples as we go through of the technical assistance they can provide. So when you get in these moments where you need it, you know who and where to call and when. There we go. So a great place to start to find information about FRIS and information about a lot of other things is our website, and it's just www.fris.org. And this is just a screenshot of our website, and you'll see one of the things you can find here is a list of all the rape crisis centers in West Virginia. So if you have to make a referral to a colleague, or maybe you need to get a hold of a colleague about something in particular, this is where you can find a list of all the rape crisis centers and how to get in contact with them. You'll also see on the left different tabs of the types of information you can find on the website, information about sexual violence or stalking. There's also some resources on here. There's a prevention tab that talks some about prevention, which Debbie's going to talk about here shortly. There is also a resources tab. If you'll see under the resources, there are a few toolkits. The first one being serving sexual violence victims with disabilities. This is one of the resources that FRIS has produced that I cite and use the most. You can find the electronic version here on our website, but many of you are also going to have the old hard copies in your office, and it's a neon green box with 4 books in it, and there's tons of great information in there. You'll see there's also a college campus toolkit for interpersonal violence, another toolkit for working with school-age children. You'll also see on here that there are several books and manuals available. One in particular is the West Virginia Protocol for Responding to Victims of Sexual Assault. This is a multidisciplinary protocol of best practices for West Virginia. And you'll also see that there are our brochures are available for download and print here as well. And of course, we can always provide those actual hard copies for you as well. So one of the projects that I help coordinate here is called the SADI, the Sexual Assault Demonstration Initiative. And this is actually a national project that I am working to help implement here in West Virginia. And the basic premise behind the SADI is to enhance sexual assault services, outreach, and community partnerships in dual agencies. In West Virginia, the majority of our centers are what we call dual agencies, meaning that they serve victims of domestic violence and sexual assault. But we also have 3 standalone rape crisis centers, meaning that they're in their area, there's a different domestic violence agency. So the SADI looked at these places and said, you know, a place that's predominantly a domestic violence agency may not seem as noticeable or obvious to a victim of sexual violence as a place to get help. Services to sexual assault survivors and stalking should be trauma informed, recognizing all the complex situations that go into experiencing a trauma. Victims of sexual assault sometimes hesitate to or delay seeking services for months, years, even decades after their assault. Whereas sometimes you'll usually see victims of domestic violence report pretty directly after an incident to seek services. So the services need to understand that and be provided throughout a survivor's lifespan. The services also need to be culturally relevant, and that's because sexual violence is rooted in oppression, and marginalized populations are sexually assaulted at much higher rates than those who are not marginalized. So this is a way to understand that. To give an example of technical assistance I would provide for the SADI project, let's say that we have a dual center who has noticed that they haven't been serving a lot of sexual assault victims. We know statistically that they're there, but they've noticed that in their service numbers, they aren't seeing a lot of them. So maybe I start with a phone call to somebody from that center and we talk out what could be some of the reasons why you're not seeing these victims. Maybe, you know, your advertising. Is it obvious to the community that you are also a rape crisis center? Maybe I would also provide some resources. The SADI created lots of resources, or I could pull them from other places. Or it could be more intensive, and maybe I could plan to go and meet with that center in person and maybe work on a community assessment to try to assess the thoughts of the community to see why they aren't accessing those services. Another part of the SADI discusses rural outreach, and there's going to be a resource related to this in your Dropbox link, which I'll send you after today. Forgot to mention that at the beginning, so that's my fault. But basically, outreach is actively assuring that your community is aware of your services and not just sitting waiting for the victims to come to you. When we speak with our community, we never know who in the crowd may identify as a survivor, but we also don't know who may end up being interested in volunteering. Could have a board member, a future board member in the crowd, or you could have a donor. Remember that we're all nonprofits here, so you could have a potential donor there. So every presentation or speaking engagement really is an opportunity to engage that community and engage their minds and let them be clear on your all's mission, on your agency's mission. When you go and do these presentations, you may be asked to do what is called a tabling event, where maybe you go and put up some information, some pamphlets, so places know of your services. You may be asked to do a brief presentation about your services and what you do. You should always be prepared with your presentation, or what we like to call an elevator speech. You should always be ready to engage with the media, because we know that sometimes the media can use just little snips of what you say, or sometimes completely distort what you've said when they're putting the story together. So if you go in there with what we call your elevator speech, and maybe that includes, your agency's services, I always like to throw in that they're free and confidential. If you have a minute to make sure that you get in there, that is nonprofit. So again, thinking about those potential donors in the audience. And you really want to think of it in terms of branding or marketing yourself, marketing your center. How can you really talk up the services that your center provides? And also, FRIS can provide technical assistance if you do get asked to do an interview or engage with the media in some way like that. We're always here to provide technical assistance for that. So another project that I help facilitate is the Advocate Training Course curriculum. And you'll see here on the screen the 4 components. The Advocate Training Course is designed to standardize the core training that all advocates in rape crisis centers who work with victims of sexual assault need to have. And so this is this training that you must have to work with victims of sexual violence. The first component of this is SASTA, which is our online training academy. I've got a slip of that on there. Thank you. So this is what this looks like. And again, the link is, you can find the link on FRIS's website, but under each of these courses, you'll see that there are several modules underneath. At the very bottom, you'll see that there is an advocate training course. This is the minimum amount of modules that the advocates need to take to work with sexual assault victims. You'll see that there are other modules throughout that aren't in the advocate training course, and you're certainly free and encouraged to complete those as well. But the advocate training course is going to be what's actually required for the training standards. So to go back to that, component 2 of the advocate training course is your agency specific training. And that is whatever you need to know about your center, your area, your rules and procedures specific to your center. Part 3 is the core advocate training. And there are 2 parts, part 1 and part 2. All advocates working with sexual assault victims will need to attend this at some point. We actually have a part 1 scheduled. Our next part 1, if you have not attended that, will be September 28th and 30th. And this will be held virtually via Zoom. Registration should come out in a few weeks for that. So make sure you keep your eyes peeled if that pertains to you, if you haven't attended it yet. And then after you complete components 1 through 3, component 4 is what's called the Training Standards Skills Assessment and Evaluation. And that's where your either training coordinator, supervisor, executive director, whoever that is that coordinates that within your center, assesses your skills. That can be done in different ways, either by conversation, observing you with victims, doing some role playing. And it's really them, assessing your skills and where you're at, where you need to be, what still needs improvement, what you're doing well, that sort of stuff. So probably one of my proudest things to be involved in since I've been here at FRIS is the advocate certification. And I'm going to be real brief here because you have to be employed for 2 years before you're even eligible. But the manual for the certification is in your resources. So you'll have that. You can look through it. And especially if you're new, just kind of get an idea of what you'll be working towards. But the certification of advocates, it really helps assure the competent deliveries of services throughout the state by increasing the capacity to assess and respond to a spectrum of sexual violence throughout the lifespan. But it also strengthens the credibility and the need for advocacy services among other professionals, such as criminal justice professionals, medical professionals, and folks like that. And so the last 2 things that I will talk about today that I coordinate, one being the advocate listserv. A listserv is really like a community email or a group email, if you will, if you're unfamiliar with what a listserv is. And I share a lot of training opportunities, if there's new resources, anything really important that I think you need to know about. And advocates are also encouraged to share on the listserv as well. Maybe you found a new resource that you think would really be beneficial to all your colleagues out there, and you can share to the listserv. So if you're not already on that, make sure that you connect with me after the call and we'll get you set up for that. I also facilitate on the third Wednesday of every month what we call Peer Power Lunch. And again, there's documents pertaining to this for a better explanation in your resources. But Peer Power Lunch is really just an opportunity to talk about difficult cases or complex situations that come up in advocacy amongst your peers. It could also just be for peer support. Maybe you've had just a really difficult case and you're just looking for some peer support. Of course, we honor confidentiality at all times. So I encourage you to read the documents that you'll have pertaining to Peer Power Lunch and join us for that, because I think you really get a lot out of peer support. So I'm really excited to be facilitating that. And that's it for me.
Hi, everybody. My name is Casey Forsell, and I'm the West Virginia SART Project Coordinator, or the Sexual Assault Response Team Project Coordinator. And this is my contact information if you have any questions. But I just kind of want to start off by asking first, who on this call facilitates a SART? Or this meeting, I guess. You can put that in the chat if that's easier for you. I recognize a couple names. Perfect. Oh, Sierra's first one is tomorrow. We have Kevin on here, Brittany Brewer. Great. This is wonderful. So a few of you SART coordinators. So we can go ahead to the next slide, Nikki. Thanks. So for those of you that don't know what a SART is, it's a sexual assault response team, and it's this multidisciplinary approach, and we're providing that support to victims or survivors of sexual assault, and our main goal is the arrest, prosecution, and conviction of the offender. SARTs are great. They're multidisciplinary teams. Each team looks totally different than the next. You know, we always say 55 counties, 55 different ways of doing things. And there's different organizations within every community that need to be at the table. But the main key players are typically some sort of medical response, prosecution, law enforcement, advocacy, and then you may have, you know, DHHR, CPS, APS, college campus, if those are in your communities. So there's a lot of different disciplines that really come to the table. And we're really looking at addressing those service gaps that victims or survivors may face when entering into that service delivery system. And we call the service delivery system, it's anywhere that a victim or survivor will report and disclose that sexual assault. So that could be, you know, it doesn't have to be just law enforcement or medical. It could be advocacy. It could be DHHR, the EBT or SNAP programs, counselors, faith-based leaders. So it could be pretty much anybody. So you want all these folks to the table so you can talk about services and what we can do to better our communities to serve those survivors. Next slide, please. So a little bit about me. I provide TA around the sexual assault response teams. I do host monthly SART coordinator virtual meetings. We also have the SART coordinator listserv. So if you would like to be on that, please email me, please reach out. I'd love to add you. We talk about trainings, and then we meet every month just to kind of talk about things that are going on with our SARTs. And you know, everybody brings different experiences to the table. So it's great to hear from folks and hear what's working in their communities, and also give other folks some ideas as to what they can do with their teams. There's a few of you on here that have been attending those. I think they've been super beneficial, and we also talk about meeting topics and things like that. So it's been a really, really great time to come together. So we have those virtual meetings, we have the listserv. I also provide TA on conflict resolution and management. We talk about Tuckman's model, and those of you that are SART coordinators, we do have the SART Summit coming up August 17th and 18th, and we'll talk a little bit more in depth on that. So if you'd like to be a part of that, again, reach out, please. We also talk about community assessments, right? Your communities have to be ready to form these multidisciplinary teams. We have to have some sort of collaboration, whether it's coordination, cooperation, or collaboration. There has to be some sort of willingness to come together and work together. And there's community assessments that assess for that as well. I have quite a few of those, so again, reach out. And then we also talk about collaboration, right? It's super important to collaborate with each other, have that high level of collaboration so that we can ensure we're providing the best services possible and that we're not letting any victims or survivors fall through the cracks of those services that we provide. We really want to provide that holistic approach for folks that are coming in our door. Next slide, please. So a little bit of a pet project of mine and Sarah on staff and quite a few others is our YouTube channel. So we do provide resources on there. Those of you that will be doing some prevention work, there is prevention on there. That is if your grant allows that and your time allowables allow that. So there is some prevention trainings on there. There's a little bit about who FRIS is on a fundamental level. There's some on intersectionality and oppression. There's a SART 101 series to get you started if you're looking at forming a SART, or even those that have been around a while, just trying to check to make sure you're still working in your scope of practice and in your lane. So there's a lot of really great information on here. There's a chance we might be moving off of YouTube here soon because we have way too much information on there and not enough space to hold it. So, but for right now, everything is on there should you need to access that. And we also have the playlist as well. So just a little bit of some resources and a little bit about me. If you have any questions, feel free to reach out and I'll put my contact info in the chat box.
I think one thing I would just add as Casey and Marcia talk, that the projects they work on are called projects because they are OVW funded competitive grants. So they have to be written every few years. And for Casey's in particular, the scope of the grant, the whole grant at OVW is changing. So when September ends, the folks who are under that grant called SART coordinators will not be called SART coordinators on our OVW grant. And if we have the opportunity to get it again starting October 1, it will take a turn towards legal advocacy. And then, you know, Casey will likely no longer be in that position. So we do rotate. Things are a bit fluid at times. And we are so thankful to our director, Nancy, who writes those and makes them very competitive. And so some folks in your agencies have very specific grant goals and achievements that they kind of have to meet on those grants. So next up we have Marcia.
Marcia Kisner, I'm the Rural Services Project Coordinator. As Nikki was saying, a follow-up to the information that she provided about grants being specific. The rural grant is something that we have had here at FRIS since I started back in 2007, and it is a very specific grant. It outlines 7, now 8 areas where we provide support and technical assistance. Some of the things that I do, like Casey and Adrian, is provide technical assistance and advocacy support, prevention awareness, community awareness, and training. One thing with the rural grant that you don't often see on a lot of the other grants that we operate under is we get to do a little bit of all of it. We get to wear the hat of doing prevention programming, we get to do the technical assistance, we get to provide direct services and advocacy, we get to do trainings, and we get to do community awareness throughout the different communities. That takes the shape in many forms. We've done some community programming, we've done prevention in schools, we've done some prevention among the community. Next slide, please. Who are we? As I said, my name is Marcia Kisner. I'm the project coordinator. I am managed by West Virginia FRIS. We operate under the terms Rural Advocate Network. We abbreviate that as RAN. That just stands for Rural Advocate Network. We are a group of sexual assault advocates that are placed within each county that are served by this grant. The advocates are hired and managed by the Rape Crisis Centers, not West Virginia FRIS. The state coordinator that you will hear us talk about whenever we're referring to a lot of our grants is Nancy Hoffman. She's the director of West Virginia FRIS. She is the one who has the time, who takes time and has the magnificent expertise to strategically write these grants to that assess and excellently pull together the services that are needed throughout our state. Next slide, please. The oops, my slides keep changing. Okay, location. As I said before, the rural grant is specific to certain locations throughout the state of West Virginia. It is not, it doesn't encompass all the counties within the state. It is right now, our services are located in Barber County, Fayette County, Jackson County, Marion County, Mason County, Morgan County, Preston County, and Upshur County. And to those areas and rape crisis centers, I provide strategic sexual assault advocacy technical support when they are facing a multitude of trying to balance out being a SART coordinator, being a prevention educator, being a community liaison, and providing victim services and hospital accompaniment. Under the rural grant, these advocates wear many hats, and they do so quite well because, as most of you know, if you're familiar with rural areas, there's not a lot of other resources in those areas. So we provide a lot of TA and resources, and we come together during quarterly meetings, and we look for new ways, strategic ways to infiltrate those rural communities and bring forth the most accurate and up-to-date information that we need to get disseminated. Next slide, please. A lot of communication goes along with technical assistance. The advocates communicate with me daily, weekly, monthly via programmatic reports, via in-person meetings, via emails. I operate a rural advocate listserv, and we have in-person meetings. We do site visits yearly, and we have trainings that we do. The rural grant, the goals and objectives are actually written out prior to, so we know within a 3-year period what trainings we will be providing and what content we will be delivering at those trainings. We communicate a lot by email and phone. A lot of times we communicate after 5 o'clock. We have a little joke amongst us that's, you know, what happens when 5 o'clock hits and we have a victim. So we all brainstorm like different ways that we come together and we discuss those issues that happens in those rural communities, because a lot of times most of the work we do doesn't happen between the hours of 8 and 5. I am the coordinator. The coordinator availability is Monday through Friday, usually 8:30 a.m. to 4:30 p.m., but we are available and there is a response at any time you should need it. Even if we don't answer the phone, if you shoot us an email, somebody's always got eyes out there, and we do consistently try to get you the assistance that you need. Emails are consistently monitored by someone at West Virginia FRIS. So if I would happen to be on vacation, your emails would not sit in my inbox. Somebody would respond back to you if you reached out to us through the Rural Advocate listserv. TA is always available. You just have to reach out. Rural Advocate Network meetings, or RAN meetings, are quarterly meetings that we hold between myself and the advocates that are stationed, and the sexual assault advocates on the rural grant positions. They are informational meetings comprised of the advocates and facilitated by me. Sometimes we have outside presenters and other agency staff will be present for capacity building opportunities. Our goal is to bring you information and resources and training opportunities to the table so that the advocate can be the liaison and take that information back to that said county. Next slide. Who do we serve? We serve victims residing in rural areas in West Virginia, victims that are geographically isolated, persons with disabilities, mental illness, substance use, etc. There are some grants that specify age limits for who they serve, but with the rural grant, we are able to serve both children and adults. We see diverse populations, minority victims, male victims, gender neutral victims, and female victims. So one of the things that I love about this grant is we can serve them all, and we can wear many hats and do prevention and direct services and community awareness. There's no stipulations as to what we can do. The sky's the limit. Technical assistance. Technical assistance is provided oftentimes round the clock. West Virginia staff and myself provide technical support on specific requests as they are received. There's a multitude of different issues that come up through the course of many cases. It could be the need to help secure an attorney for someone seeking legal means. Lots of things, you know, being able to contact a specialist outside of their catchment area, or finding an interpreter or transportation. We receive a lot of requests, various forms, and a lot of times, sometimes we may not have the answers, but we are the pilot that will get you the answers. That's all I have. Again, my name is Marcia Kisner, and I'm the Rural Services Project Coordinator, and my information is there. If you need anything, feel free to reach out to me.
So I appreciate that. It's, you know, some folks, they work so much, and that Marcia shared, typically we're 8:30 to 4:30. Some folks vary when they come in, but 8 to 5, you know, you can usually reach someone.
Yep.
But we are not a crisis agency. We do not provide direct services. So you may not be able to reach someone after 5 o'clock. But if it's like, you know, stuff, a lot of us do check our emails. We are here for you. And so next up we have Christina Lipscomb. I'm trying to find you, Christina.
All right. Well, good afternoon. Hopefully you all are still awake and with us. I'm Christina Lipscomb. I've been with FRIS for just a little over 4 years. My background is in mental health. I've been a therapist for about 20 years. So I've done a lot of mental health, behavioral health types of stuff in the past. My current role for FRIS is the Special Victim Services Coordinator. And like Adrienne said, she's one of the Victim Services Coordinators. My role is more focused on the broader aspect of what services are available throughout the state for certain populations. So we're looking at what services exist under that umbrella, what service needs there are, and then partnering with other groups and agencies throughout the state to look at how we might build some of those services that are needed or find resources for specific populations. I can provide technical assistance and training as well as resources. I also do a lot of our training around the neurobiology of trauma and sexual assault, as well as our self-care and vicarious trauma training and resources for our advocates. Prior to this role as the Special Victim Services Coordinator, I was the Sexual Assault Kit Initiative Coordinator and am still a liaison for SACI. One of the things that I still monitor is the Sexual Assault Kit Initiative Victim Information Line, which is my direct phone number that's listed there on the slide. It's not a crisis line either. As Nikki mentioned, we don't do crisis, but it's simply an information line where individuals can call me if they have heard about SACI or if they had a kit collected after an assault and had received no follow-up or information. They can call a number and, excuse me, I will try to connect them with the appropriate agencies or people to determine what the status of their kits are. I can also make some referrals for services in their local areas or provide additional resources if they so desire to have those. I can also provide TA around cold case advocacy, victim notification protocols for these cold cases. As cases come back and agencies begin to investigate, there are protocols based on best practices for how to set up a plan for notifying those victims. And then I can provide project resources and TA around SACI. One of the good things to come out of this, among many, we started the SACI project in 2015, and our labs are wrapping up that testing. I think it's primarily done at this point. But one of the interesting pieces of legislation that has come out of, partly out of the SACI project, is the requirement for sexual assault kits to be directly submitted to the West Virginia State Police Forensic Laboratory. So that's essentially any medical facility that collects the forensic exam kit will send it directly to the lab instead of sending it back with the law enforcement officer and then the law enforcement agency having to send it on to the lab. And I've put the link here for that statute specifically if you want to read it, but I wanted to highlight just a couple of the pieces in that that are important. And that's the requirement for the healthcare provider to submit those kits to the lab within 30 days or as soon as possible, based on the circumstances. The state or local law enforcement agencies that are responsible have to obtain approval from the circuit court before they can dispose of those kits or any biological evidence. And in addition to that, before any disposals or destroying any of that evidence, the prosecuting attorney is required to make reasonable efforts and attempt to contact the victim in order to notify that person that the kit's going to be destroyed. So once the lab gets them and completes their testing, then they will send it back to the appropriate law enforcement agency who will maintain that kit for their investigation, should there be one, or they'll maintain it in their evidence. And then the other piece of this is there is now a penalty. It may be a small one, but there is a penalty for noncompliance with the statute. So if anyone is found guilty and convicted, they can be fined from $50 to $200 or be confined to jail for up to 60 days. Or both. So the special populations for my grant right now, I work under the VOCA grant, and the populations that we've identified for my position to focus on are incarcerated adults and youth as part of the Prison Rape Elimination Act. If you're not familiar with PREA, Congress passed this act in 2003 to address the persistent problem of sexual abuse and assault in correctional facilities. And as part of that act, correctional facilities are mandated to implement practices and adopt a zero tolerance approach to sexual abuse and assault, and to have a process in place for reporting and for providing services such as advocacy to any inmates or youth who need that service. So while PREA doesn't mandate that the correctional facilities have to use the rape crisis centers to provide advocacy, they do. It is called for in the protocol or in the provisions for victim services. But right now in West Virginia, most of the incarcerated individuals we're serving are in the jails. Some of your centers have existing memorandums of understanding, some are in process. And so I know some centers are getting more calls than others, but the way that's set up is the inmates or youth have a confidential opportunity to make a call to a rape crisis center. They don't have to report to police. There are some tricky areas to navigate regarding a prison or correctional facilities request for information. So those are the types of questions I could field or try to assist with if you have questions about PREA. The other part of my grant responsibilities are to look at human trafficking and homelessness or housing needs throughout the state and other needs those individuals might have, such as legal services. So We are currently working with other work groups in the state to address any service needs that aren't available, what those particularly might look like, and how we can build those or connect with other agencies to make sure we can connect any survivors who seek services because of human trafficking, how we can connect them with the services that they need. And if those aren't available, as I mentioned earlier, we look at how can we build these and in what would be the most efficient way to do that. The other population we're really looking at right now and looking to build resources on is the adults in later life. We don't have a lot of specific programming out there for this population. So this one is also in progress, looking at what services are available that target or focus on seniors or adults who are older, looking at the specific dynamics around sexual assault for these particular groups and what individual or specialized needs they might have or specialized services that might be needed. And then we will continue to look at that for other populations that are marginalized as well, because while the sexual assault response is going to be similar in any case, each of these populations may have specific needs that we aren't quite meeting if we don't have some further awareness and education around their particular circumstances or experiences and things to consider regarding the dynamics around those particular groups. So I can assist with connecting you with information or resources or try to help guide you in the direction you need if you're looking for services or options for individuals in these areas. So that's kind of what I do.
Christina, before you do your exercise, I wanted to chime in here. That's a lot, and just making me recognize that there's so much training and things to look forward to when we look at reaching all types of victims, and we offer a lot of training. But that's why we all split up the work, because we couldn't do it at all. And part of our role is to really help you. So if you run into these issues and you haven't had training, or it's been a while, or you need help with, human trafficking, or need training on adults in later life, that's where we really encourage you to reach out to us. We partner closely with our sister coalitions, such as the DV Coalition, West Virginia Child Advocacy Network, and others. So the adults in later life, there's been a curriculum that is often trained, and you have to stick to that. So it has to be those trainers. But that's why we sit on other collaborations and other groups, so that we can partner with them, like the Human Trafficking Task Force. So if you or your group or whoever needs training on that, sometimes folks have identified topics, and Christina and other folks have went out and trained your staff because of the expertise that they have to be able to bring to your agency. We've had a lot of turnover even with directors in the last few years. So it's just really hard to keep up, and that's why we're here. We sometimes sit and do half a day of research on new material, statistics, revamping training curriculum. And we know that when you're out there helping victims, you don't always have the time to do that. So that's how we work so well together. So I also wanted to ask, since that was a lot of topics, if anyone has any questions for Christina around SACI or particular populations. We have had contracts with the regional jails and the prisons, and that has all changed. So things are constantly changing, and we try to keep up to date on all of that and get the information out to you all. So the directors also sit on groups to get the information sharing between the membership programs, other people serving sexual assault victims, and FRIS as well. So any questions? You can unmute or throw it in the chat.
There's a lot to consider with PREA. So the advocate guide is going to be in the resources that Adrian will share with you after the call today. And it has so much more information than I could ever possibly cram into a couple of slides or into this time frame, but it's a really good resource to refer to if you are seeing these calls or getting these calls and you're seeing these clients. It will be a good resource for you. And we have the human trafficking protocol is going to be in your resources as well for responding to those individuals.
So if you'll throw in the chat real quick how everyone in one word is feeling at this point. Overwhelmed, new information, couple words. Let us know what you're thinking, where you're at, because we do have several other folks coming up to chat a bit more. So let us know if you're still there. There's 50 people. Someone there? Melissa's still here. Thanks. How many people are multitasking? Thank you all for responding.
So I mentioned the self-care piece. I've done a series of webinars with FRIS for our advocates over a period of time last year when we were all adjusting to the changes that COVID brought to our lives. And we've done several trainings related to self-care and vicarious trauma for advocates during our core advocate training and at our symposium. So we wanted to take just a moment and do a quick exercise. If you need to stand up and stretch, do that. But this practice I've shared before, it's really simple and it's brief, and it's something you can use on the spot in the moment if you're just feeling kind of reactive to a circumstance or a situation, or if you have 5 or 10 minutes and want to take a little longer to kind of release some of the stress of your day, or just the tension you hold in your body or frustration or whatever it might be. And the stop practice is really simple. And you would start just by sitting in a comfortable position with your feet on the floor, your hands where they're comfortable. You can close your eyes if you'd like. It helps to minimize distractions. Take a couple of deep breaths slowly in through your nose and out through your mouth. And you just take that second to stop, pause, kind of set down the frustration or disengage from the stress or the frustration or the situation, whatever it is that you're encountering for that moment. Take a breath and really feel your breath filling up your lungs and expanding. And as you exhale, kind of letting all of that stress and tension flow out with the breath. The next step is to really observe what you're feeling in your body, the sensations, anywhere there might be tension or tightness or pain or discomfort, and then noticing and observing what's going on in your thoughts and your emotions. And we're doing this with curiosity, not with judgment. So it's not a process of saying, well, this is wrong, or I shouldn't think this or feel this. It's just observing it and allowing it to be there. And then after you've done that, to proceed with what feels like the right next step. So after you've stopped to pause, you take that breath, observe what's happening in your body and your thoughts and emotions, and kind of exhaling all of that out. Then you take a moment to decide what's the next step that would be the most wise course of action for me. And then you proceed. And this is just a really quick exercise, but if you're in the middle of a busy, stressful day, you can take just a second to stop and do it. It's all in your head. No one will even have to know what you're doing. Or as I said, if you have lunch break or another break and you need to go sit for 10 minutes somewhere, you can take the same practice and just extend the time that you're doing it for a little bit longer to really give your body a chance to release that stress and tension and kind of refocus yourself back to the present moment. So that's it for me. And this is my contact info. If you have any questions or need information or help, I am here and you can reach out.
Hey everybody, my name is Sarah, and like Adrian, I am coming up on my 3-year anniversary with West Virginia FRIS. Prior to coming on board at FRIS, I worked for about 8 years in community-based advocacy programs. So I worked for 5 years at the YWCA of Wheeling, which was a domestic violence specific agency. And I did pretty much everything in my 5 years there. My first year, I worked in the shelter and answered hotline calls. And then my next 2 years after that, I did legal advocacy. And then my final 3 years there, I did teen dating violence advocacy at the local high schools, colleges, and in the juvenile detention center that's there. And then after that, I worked for about 3 years at Centers Against Violence, where I also did a little bit of everything. And I am the Stalking Resource and Campus Resource Coordinator for West Virginia FRIS. As part of being the Stalking Resource Coordinator for West Virginia FRIS, I am responsible for sharing information related to stalking. And so that can include things such as, upcoming webinars or trainings or continued learning opportunities. It might be an academic report that came out about stalking. It could be an event. And I'm also responsible for sharing or creating resources related to stalking, such as this awareness video that we'll watch here. That's just a very quick example of a resource that I might create and share with folks. And so another example of a resource that I create every year is called the National Stalking Awareness Month, or what we call NSAM. I know there are a lot of acronyms, but the NSAM Toolkit. And so National Stalking Awareness Month takes place in January, and it takes place in January because of the tragic stalking case of Debbie Riddle, who was murdered by her stalker in the month of January, and whose sister really worked hard to advocate and get more awareness and recognition for stalking. And so that's sort of how that's the origin of National Stalking Awareness Month. And so the National Stalking Awareness Month Toolkit is created every year as a resource really for folks to help them understand stalking better, stalking behaviors, stalking dynamics, the impact that stalking has on folks who experience it, how dangerous stalking is, like the video we just saw, what other crimes stalking might intersect with. And it's also a tool to help folks provide your own awareness and programming about stalking. In the toolkit, we provide programming ideas, and it's also intended to help folks have conversations about stalking, whether that be, at your own agency staff meetings, or if you are a SART coordinator at a SART meeting, via the discussion guides and scenarios that we would provide. Another responsibility I have as the Stalking Resource Coordinator is to do presentations and trainings. And so, the NSAM toolkit gives folks information and ideas and directions for how to implement those ideas. And I like to think of presentations and trainings as bringing the toolkits to life, to really let folks learn more about stalking, to learn more about what we put in the toolkits, to provide an example of what we put in the toolkits so that other folks can do that, and be comfortable using the toolkits to provide, your own presentation and trainings about stalking. And just a couple examples of recent trainings we've had regarding stalking. We've had a training called Identifying and Responding to Stalking. And we just recently had a training in conjunction with the Putnam County Sheriff's Office and the West Virginia Prosecuting Attorneys Institute regarding improving coordinated community response to stalking. So those are just a couple examples of presentations and trainings that we provide about stalking. Then the other hat that I wear with FRIS is the Campus Resource Coordinator. And the things that I do under campus work is that I facilitate what is called the Intercollegiate Council Against Sexual Violence, and we refer to that as the ICC. And the West Virginia ICC began in 2002, so it's nearly 20 years old. And what it is, it's a statewide council to address the issues of sexual violence and stalking on college campuses. And it provides a forum for sharing resources, policies, materials, and prevention programming ideas. You know, Adrienne talked in her part of the presentation about really how important peer support is, and that's the same thing that the council provides as well. It's an opportunity for folks who work on campuses to come together, to network, you know, to ask questions of each other, you know, like, hey, what are you doing for National Stalking Awareness Month? Or, hey, you know, we would like to try something different. You know, what are you going to do for Sexual Assault Awareness Month? And it also really provides an opportunity for us to identify needs that our campuses are seeing. And so, for example, at our last Intercollegiate Council meeting, these are all of the needs that came out of that meeting. These are the things that folks identified that they'd like to learn more about. So helping students with disabilities, the intersection of Title IX and Clary, working with marginalized communities, transgender students protected by Title IX, restorative justice and its role in working with students, coordinated response strategies with law enforcement, the intersection of historical trauma, gender, and race, and how West Virginia students measure up with students across the nation in terms of knowledge and behaviors. So the needs that we identify at the ICC meetings really guide what I share on the ICC listserv. And so the ICC listserv is for anybody from a college campus, whether that be residential or community. It's open to anybody who works on a college campus, or advocates who do or are planning to do work on campus, or allied professionals who might provide programming or response to college campuses. So our next ICC meeting will be on September 2nd, and we'll be joined by the Stalking Prevention Awareness and Resource Center, also known as SPARC, and they'll provide a presentation for us about stalking on campus. So if you think that you might be working with your local campus and you want to join the listserv, I will put my contact information in the chat, and you can just reach out to me. And again, like other folks on staff, I also provide technical assistance, which is specific resources and assistance based on technical requests I receive. So for example, just some examples of TA that I might provide. Recently, a campus reached out to us and they wanted their students to learn more about Title IX. They really noticed that there was a gap on campus and that students really didn't understand a lot about Title IX. So we helped them along with their local rape crisis center. We all worked together to help them plan a whole Title IX awareness week. And we connected them to resources and folks who could present during that week. And we provided a couple presentations ourselves. Another example of TA that I've done is, somebody reached out to me and said, I would like more information about sexual violence in marginalized communities. Is there a one-page resource out there? So, we can find information about, sexual violence in folks with disabilities, for example, or sexual violence in LGBTQ plus folks, but there wasn't one place where there was information about lots of marginalized populations and how they experience sexual violence. So that's a resource that I'll be working on to create this one-page resource for folks to use. Another example would be, somebody reached out and said, we want to do something different for our programming, and we'd like to try something involving awareness programming around art or dance. And so I provided them with resources of things that they could do and examples that other campuses and rape crisis centers have done around using art and music to do sexual violence and stalking awareness. And then also, things went virtual these past few years, and we really took that seriously and considered how how that might affect bystander intervention. And so we created an online bystander intervention toolkit with tips and resources about how to be a bystander in online spaces. And so those are my roles at FRIS, and I will put my information in the chat box if you would like to contact me. Thank you so much.
Thank you so much for that, Sarah. And you brought up some really key points that made me think to let folks know. Always talk to your supervisor or director if you want to join a collaborative, because there may be someone else who's already serving, or you're stretched thin and only one person can serve, and bring the information back to your agency for them. Also, Casey talked a little bit about conflict resolution, conflict management. Sometimes there have been instances where, you know, folks just aren't playing in the sand well, and we can help with that by taking a different approach. Sometimes we're able to come at it from a different angle and help reduce conflict among your teams or other allies within your community. So we're very strategic about that. We're very protective of our rape crisis centers because you all mean so much to us, and we know that the more we play well together, the better victims are served in the end. So that's really, really important to us. So Debbie, I will pull up the screen here so you can share. And if anyone has any questions, again, you can feel free to throw those in the chat. And thank you so much for hanging with us.
Absolutely. Thank you, Nikki, for taking care of slides today. Let me just say that I'm Deborah Bonasso. I'm the Education/SANE Coordinator. And probably you figured out by now that I'm the senior of this crew. I can remember back at the very beginning of my time in FRIS, I've been here for about 26 years. It was just Nancy who was part-time, and I was part-time. So over these last 20 some years, things have changed. Not only have we grown, but our work has changed, and prevention has taken on such a meaningful life in our work. So I want to just talk to you about prevention. Everything prevention is in my world. We do have some prevention educators who are on this call. So if you are, I'm going to ask you to throw your name in the chat, tell them where you are, because you will be a good resource for all the newbies who are now going to be able to do prevention. So in our work with prevention, we are firm believers that violence is preventable. And so we look at getting rid of those old concepts that used to say to anyone, you take care of yourself to keep yourself safe to prevent violence. But we know with primary prevention, which says, let's stop the violence before it happens, that it is preventable. It is a public health issue. And with all the new folks who are able to do some kind of prevention, I do believe that we have the potential to make a real impact, because education is power. And that's really what prevention can do for us. So prevention can take many forms, and you've heard others today talk about awareness. You've heard people talk about prevention, but I want to have us outline in a little more detail what the differences are between the three. So if you're doing awareness, if you are allowed under your grant and your goal is to do prevention, then you're really going to work on raising consciousness. You're going to want the community to know about your services, and you're going to probably do one-time conversations about that. It's that elevator speech that you heard mentioned previously. That might be those resource tables. That might be putting up posters. That might be a library display or some individual information on your Facebook post about your agency. How is that different from risk reduction? Well, I can tell you when I first started doing prevention work, that is pretty much all I did. I feel badly sometimes when I remember how many presentations I did where I said to young women, be sure you go out together. Make sure you park your car under a street light. Make sure that you look in the back seat before you get in when you're out at night. It really was the message that said you increase your safety by doing all these things that we say that are important. So the onus of safety was put on each individual. remember used to, in presentations, we used to say to men in the room, what do you do when you're out at night, you're alone, when you get in your car, versus what do women do at night when they're out alone and they get in the car? Well, we don't do that risk reduction as much today as we used to. We still do self-defense classes and those kinds of things. We do know that many campuses have done blue lights. We do still give safety messages, and I'm not saying that they're not important, they are. But what we've learned is that if we really look at primary prevention, we have the opportunity to really change the social norms and those pieces that create the violence. So primary prevention does two things. It looks at how do we determine what we should do to keep anyone from becoming a victim, but also what do we do to keep anyone from becoming a perpetrator. So here's a little tip that I'll share with you as to how you can distinguish risk reduction from prevention. And this is the question that you ask, who's responsible? So if the person responsible for creating the safety is that individual, then it's going to be risk reduction. But if the responsibility for preventing violence falls on the shoulders of us all, then it's going to be primary prevention, because we're going to really look at how do we change the narrative? How do we change the social norms? So what I want you to do is put in the chat, I'm going to give you a couple of statements, and I want you to put in the chat if you think they're awareness. And if they're awareness, put an A for awareness. That'll be easy and quick. If you think it's risk reduction, put an RR. If you think it's primary prevention, put a PP. So here's the first one. What do you think prevention would be if it's a defense class for women, a self-defense class for women? What kind of prevention would that be? Okay, you nailed it, right? It's risk reduction. What about a group, you're working with a group of high school students on a school-wide campaign focused on consent and respect? What would that be? Awareness, risk reduction, primary prevention. You're working with a group of students on a school-wide campaign. This one's tricky. School-wide. Is it going to be awareness? We're just going to have one-time conversations, or are we going to put responsibility for changes on individuals, or are we going to try to change norms? So those of you who put primary prevention are exactly correct. It's more than awareness, because we're going to talk, we're going to work on putting into place conversations that are going to really hone in on what consent would be and what respect would be. If it were awareness, I might only put up posters in a classroom, in a school, in the library about what consent means. What would this one be? Tabling at a health fair. Would that be awareness, risk reduction, or primary prevention? Absolutely awareness. And let's try one more. Providing bystander presentations on a college campus, giving skills to be able to intervene in situations that students didn't feel were safe, much like Sarah talked about. Would that be awareness, risk reduction, or primary prevention? Yeah, Miss Liz, you were the first on the click there. It is absolutely primary prevention. Anytime that we're trying to change behaviors and attitudes and teach skills. So prevention can take many forms. So if we look at the next slide, in prevention work, the goal will always be to stop violence before it happens. And one of the ways that we explain primary prevention is by a quick story. I'm going to give you the quick story about the moving upstream. And this little visual, I hope, helps explain it for you. And what it talks about in this moving upstream story is that imagine in an afternoon that a man is at the riverside and he's relaxing and he's fishing, and he hears a cry for help. So what does he do? Most of the very same thing that you would do if you heard a cry for help. You'd put down whatever it was that you were doing and you'd rush to provide aid and help. And that's exactly what this fisherman did. And he saw somebody in the water. He pulled them out to safely, wished them well, went on his way back to his corner to have a relaxing afternoon and fish. It wasn't long before he heard someone in trouble again. So he does exactly the same thing. He puts down his pole, he rushes to help and finds someone else in the water. Now this happens 2 or 3 or 4 or 5 or 6 times until he decides that maybe the better decision would be to find out what the problem is, to find out why people are falling in, and to fix whatever the problem is with a solution. That really is what moving upstream is all about when we talk about prevention. So he could do a couple of things. He goes to the bridge and he finds out that there's a hole in the bridge and that it's such a beautiful view. People want to enjoy the scenery, and so they get a little too close and they fall in. So he decides that he can do a couple of things. He can post signs that say danger ahead, hole in the bridge. He could fix the bridge, and or he might teach people to swim. Any of those options might work. Some of them would be better. But that's really what moving upstream is all about. Finding the problem, looking at your community and deciding what are the risk factors and how are we going to fix them, and then working hard to prevent the violence before it happens. And so that's really the goal of primary prevention as we look at what are those things in a community that create the opportunity for violence. So that's one of the things that I want you to think about in your community. As some of you will move forward to do prevention work, you'll do awareness. Some of you will do risk reduction. Some of you will do primary prevention. But in any of the prevention that you're doing, it's going to be vitally important that we prevent violence before it happens. But we know that if it happens, we want folks in the community to know where those services are to provide help. So if you look at the visual, you see the little guy over here saying, stop, wait, the water's rough. I don't think you want to swim today. It's too dangerous. But you can see here with secondary prevention that people are swimming, people are fishing, and the onus behind that is if we only help one person at a time, how will we ever stop the prevention from happening in the first place? And so fixing the bridge is what our prevention programming is all about, as you'll see on the next slide. So that's what I want you to think about in your communities. What are those risk factors? What are those things that create violence? Is it poverty? Is it lack of economic ability for women and girls? Is it gender norms around sexual violence? Is it the differences that we see facing our college students who are LGBTQ on campus? Are we allowing our young people to grow up in safe environments? Are we teaching body safety? These are some of the ways that the prevention educators and I work in the state to fix the bridge. And these are things that we're hoping that if you're going to be doing primary prevention, these are some things that we want you to think about in terms of your community. Are these risk factors? And if they are, how will you change them? How will you provide the protective factors that can stop the violence before it begins? Conversations about healthy sexuality are critically important. In our prevention work, we work with K through 12 students. We work with communities, we work with disabilities, and also with colleges. Sarah and I have an opportunity because we're working with college campuses to do a lot of coordination and a lot of work. And one of the things that you're going to find about prevention work is they can't do it in silo. Actually, you can't do any of this in silo. Actually, last night, Christina joined the same nurses to do a presentation on PREA. So we want to collaborate, we want to communicate. You heard Casey talk about collaboration and communication, and that's why it takes a team. And just with our prevention work, it's going to take a team. And I so want prevention to be an integral part of your agency's goals, your values, and your missions. So programming for men and boys. One of the things we did last month was offer a clinic for coaches working on developing a leadership program. We do lots of programming around challenging stereotypes and gender norms. We work really hard to teach healthy relationships, positive childhood experiences, the importance of connection matters. Relationship building is one of the most important things as an advocate you're going to find regardless of the work that you're doing. It's also one of the most important protective factors for youth, connecting them to a safe and caring adult. It's also the most risk factor for youth is when they are not connected to a safe and caring adult. Can't tell you through COVID how relevant body safety programs were and are. Finally, I think people are understanding that that can't just be a little add-on that we put in our curriculum around social emotional learning or body safety. We want to protect kids from being harmed, and there are things that we can put in place to do that. That's all part of prevention education. We want to build communities that are connected with resources. We do want to increase opportunities for women and girls. We know that there are a lot of single moms out there. So what do they do about childcare? Nikki and I had an amazing conversation with after school care folks this week that will help us make sure that we offer additional resources to help in some aftercare situations. And then certainly across the board, regardless of what we're talking about, we have to address how do we teach skills around boundaries, communication, and certainly consent. So these are all ways that we're going to fix the bridge. So as you think about your prevention work, what will you be interested in doing for your community? And as you think about what you're going to work on, you also have to determine who your population will be that you serve. So in the next slide, you're going to see the spectrum of violence, of prevention against violence. And one of the things that you have to determine is, where are you going to work? Are you going to work on changing individual and behaviors and attitudes? Are you going to strengthen your own knowledge around that? Are you going to work in relationships to do that? Are we going to build relationships in our staff, in our community agencies to do prevention? We certainly know that educating providers is really important, be it school staff, be it counselors, mental health folks, your partners in prevention teams, sitting on committees where you build capacity. And then we hope that when we educate providers, we get the opportunity to build coalitions and networks. You might have noticed, and I see I didn't put it on this slide, but there's that little "It's on Us West Virginia" logo that was at the beginning of my presentation, and I hope it's on the next slide. But that's one of those initiatives that we have organized around prevention of child sexual abuse. And that's a campaign that we're really going to brand to encourage everyone in West Virginia to understand that it is on us to prevent violence. And here are the kinds of things we can do if you're working on a college campus, if you're working as a multidisciplinary responder on a SART team, if you're an advocate on the RAN network. It's on us to educate and to change attitudes and behaviors. However it works best in your community, bring together your partners. Then what we hope happens is that there are organizational changes. And then we hope that we influence policy and legislation, much like Erin Marin's law around body safety. Currently in our state, all school staff, K through 12, and all students are supposed to receive education around body safety. And some of that initiative through the Child Sexual Abuse Work Group is making that happen. So it's working individually, in relationships, and community, and in society to get to the ultimate goal. So if you're going to be doing prevention work, on the next slide, here are some key resources that are great places to start. These come from NSVRC and from Prevent Connect, just to get you started on the very basic primary 101 prevention. We can't do that today, but these are some good ones, and these will be resources that will be in the Dropbox link that are coming your way after this. The Moving Upstream story is part of that. There's a whole online learning around prevention education boot camp, and there's a nice little video that goes with that story. And then for those folks who are going to be doing prevention, on the next slide, you'll see some of, well, I forgot about this one. This is our SASTA-FRIS.org Academy. And this is a place where I'm going to strongly recommend. I wish I could require, but I can't do that. But I hope that you'll want to do this. We have our own prevention module in the SASTA Academy, and you can see how very thorough it is. So you learn first about getting started, you do an assessment, you determine your skill, then you look at the principles, you look at how you frame your programming, you look at all the possibilities, you plan it. We use the public health approach through the Centers for Disease Control. So we say, okay, so here's how we're going to prevent violence. we're going to try this program, we're going to do it, we're going to evaluate it, we're going to look and see what parts of it worked really well. If they did, we're going to continue, but if it didn't, we're going to go back and evaluate. Who else do we need to bring to the table? All of those things are in all of those modules. So we certainly want you to take care of that. And then with our educators and the programming that they are doing around primary prevention allows them to do work in teen dating violence with safe dates. We have a great curriculum that we like called Relationship Smarts Plus, as you can see here. We are fans of Second Step when we do child protection. We have bullying curriculum. We have an out-of-school care curriculum. And there's also a professional development curriculum that we're going to be talking about very soon. Coaching Boys into Men, I mentioned. Mind Matters is a program for addressing how to recircuit the brain, rewire after trauma, especially for adolescents who are at risk. And then bringing in the Bystander, which was a program that Sarah mentioned that our educators have trained on, both for high school and for college, and we work collaboratively on that. And there's that It's on Us West Virginia logo specific to our child piece. And then to the right, you see it's on Us West Virginia. It's a collection of resources that the educators worked so hard on, along with Nikki, during COVID, to provide information for teachers, for parents, on a variety of things that we felt were really important for folks to know during COVID. The next slide mentions 9 things that puts prevention programming in a different category. You heard Adrian talk about attending trainings to become certified as an advocate. Well, there's a lot of training that goes with doing prevention work. It's not just saying taking up a curriculum off of the shelf, going into a classroom to offer it. It's got a lot more. There are 9 principles that are very important in offering program that came from work that was done around substance abuse, mental health. And we know that if you're going to do effective programming, if it's really going to have the impact that it says it's going to have, then it has to be comprehensive. And what we mean by comprehensive is that it has to be more than a one-time conversation. You have to have multiple opportunities to change attitudes and behaviors. It has to have a variety of teaching methods, which means we want to teach skills and we want folks to be able to apply what they're doing. It has to be based in, it's evidence informed, and there is data to show that it is working, and it is developed based on behavior theories that we know work. We want to build that connectiveness with relationships. We want to make sure it's appropriate to young people, college students, that it is appropriately timed for their development. We want to keep track of data. We want to make sure it's relevant to where they are, to their ethnicity. And number 9, I can't say enough, it's well-trained staff. You have to be well-trained in prevention first, and then well-trained in the content of whatever that curriculum is going to be. And we are going to be offering a prevention boot camp across the next couple of months for any of you who are going to be doing primary prevention who might want to join us. So we provide technical assistance. I have a great team of educators who would be very happy and will be providing some of this information to you. For those of you who have those educators in your center, you're already going to be steps ahead. So trainings, we're all about that. Please check in with us about questions about prevention programming, any kind of curriculum information you might need. The CSA Collaborative, which we're hoping all of you will develop in your respective communities, and then how to mobilize the community to build capacity. So please don't hesitate to contact me. We don't know what you need. If you don't tell us, there's my contact information, and I look forward to hearing about the great work that you are going to be doing around prevention, be it awareness, risk reduction, or if you're jumping into the water, top to bottom, to do primary prevention. So thank you.
I feel like you have the topics that aren't talked about the most, Debbie. That was very informative. Another point that I wanted to bring up to folks is one thing that Debbie had taught me when I came to FRIS is that history matters. So if you work in a community and maybe you're the new kid on the block, or even your agency is the new kid on the block, first thing I would do is reach out to FRIS and ask about that community, how things have been working, what's happened in the past, so that you can be best prepared to determine who to reach out to, you know, who doesn't play well in the sand right now. But the importance of when you do, if you're new, meet people where they're at. You don't have to have all the answers right away, and that we're here to help.
And Nikki, let's add to that, don't work in silo. You cannot do this by yourself. It takes the village, truly. Absolutely. Okay. So I'm going to switch hats. I'm going to move from education to SANE. This is another one of my loves. This is something I've been working on with FRIS since 1998. It's been quite a journey. We make progress, we go back. We make progress, we come back. But huge progress has been made recently with the addition of additional SANE faculty. So I want you to know who they are. Know that if they could have been here today, they would be. They could not. All three of them have full-time other jobs. We do a lot of nighttime work, as Marcia talked about. We meet regularly, many evenings. Margaret Denny is the SANE project coordinator. She's been with FRIS since 2016 now, I believe. Jennifer Lear, who is on my left, just came on board as a SANE project program specialist, and she's going to be serving communities in North Central West Virginia, Harrison, Gilmer, Mon, all of those. Cynthia Clark, who is also a SANE program specialist, will be serving the southern part of the state. Thank you, Nikki, for taking care of that. And Margaret will take care of the panhandle wheeling up around those areas. And we are so happy to have three SANEs ready to build programming, ready to do trainings, and to help your clients who present at hospitals to get forensic medical exams. So their information is there, and you'll be hearing more from them as we go forward. I hope everyone knows what a SANE is. It's a sexual assault nurse examiner who has had specialized training to take care of anyone who has been victimized by sexual violence. And we know without question, if you have had the opportunity to respond to the hospital and work with a SANE, and put it in the chat for me, if you have had a SANE provide services to anyone that you've worked with, I hope and pray that you found that it was a much better experience because of their training, because we know someone who is trained knows better how to collect the important pieces of evidence. We know that if a SANE is on call and comes in and works just with that one patient without being responsible for other people within the hospital, that they do a much thorough job. A SANE exam can take anywhere from 3 hours, 4 hours, 5 hours, 6 hours. It really just depends on that individual case. We know that when a SANE collects evidence, we hope that there is some DNA that will connect it to that perpetrator. But we can't put all of our eggs in the DNA basket. We'd like to, but we can't do that. But what we do know is that a good medical history can connect and can corroborate the story of that patient, which also can absolutely be used in cases. We've had to say this a lot to hospital administrators. It's more than a box. Our sexual assault evidence collection kit, which we call SAC. I can't tell you the number of people who have said to me, hospital administrators, Debbie, it's a box. Look at it. It's filled with paper. It has swabs. It has envelopes. What's the big deal? Why do these nurses have to have all this training? Well, it is a big deal because sexual assault is a medical emergency. And SANEs are taught how to collect, when to collect, what questions to ask. It's vitally important that training happens. One of the things that we've done with our crime lab here in West Virginia, and I have to give them kudos and shout outs because of their good work, we have a feedback system in place because they were willing to go the extra mile. We call it the SAC system. So every time they analyze a kit, they look at certain criteria to decide, was that kit well collected? Does it need a little bit more work, or did they just miss the boat completely? We keep track of that. We share that with hospitals. We share that with individual SANEs, and we use it for training. One of the things that we learned was that our nurses were not, our SANEs, were not doing a great job preparing slides. So over the course of a couple of years, when we continued to see that be an issue, it was one of the things that made some people have a poorly collected kit. The lab decided to remove that step from the SAC. So no longer do they collect the slides, the crime lab prepares them. Somebody might get a poorly collected kit if clearly it was drug facilitated from the medical history provided by that patient, and they don't do a toxicology kit. It might be a poorly collected kit if it's clearly documented in the medical history that she was licked and there's no swabbing of the breast or the areas where he or she reported that they were licked. So what this does, it gives us an opportunity to go back to individual providers to share information and knowledge, not to be punitive, but to help collection be the best that it can be. So we've been tracking the feedback, and without question, the data shows that nurses who have been trained to be SANEs, who've done their 40 hours, who've done their 25 hours of clinical, are better at conducting forensic evidence. And so it continues to push us forward to want our hospitals to develop SANE programs. And we offer the opportunity for trainings for free. Again, we have to give great kudos to our director, Nancy Hoffman, for her creativity in writing grants that allow us to do trainings for free. We offer a SANE practicum in addition to the 40-hour coursework that some states are charging $750 per individual. These are opportunities for the nurses to come back to get clinical hours where they actually can work with a gynecological teaching assistant, where they can do mock exams, they can really learn how to do it well and right. We can work with your hospitals to develop the program. We can help them do a business plan. We can provide them with amazing SANE resources, protocol development. Recently, because of COVID, we haven't been able to do as many trainings across the state as we'd like. So we have been doing ED trainings, bringing the hospital staff together to talk about changes in the kit, direct submission, victim notification, little pieces about the slide. We've changed some swabbing that we wanted them to be aware of because the site of collection is so critically important. Our SANEs are available to come to your SART meetings and talk about medical response. And if your medical folks aren't on your SART team, we have got to talk with you. We've got to get our medical responders on your SART teams. That's going to be the way that we build our programs across the state. Again, we collaborate all the time with the West Virginia State Police Forensic Lab. And so much so that they work closely. We've been revising the kit, which we call the SAC, as I mentioned earlier. We're streamlining some things, and they really find value in our SANEs' opinions. So we work closely. Again, can't do this work in silo. We do have to collaborate. And I do see that a couple of you have mentioned some of our SANEs that you work with. Meredith at Ruby and Melanie Williams, who is at Logan. So again, I've already mentioned the training. It's extensive, 24 hours online. It is free, 16 hours in the classroom where they actually use the kit. And then, as I mentioned, we do the same practicum skills day, which allows them to work with a preceptor to practice. Practice only makes perfect if you do it right and well, and there are a lot of pieces to those clinical requirements that they need to accomplish. One of those, which is an optional opportunity, is one that we feel is really important, and I hope they'll be reaching out to you. We ask them to contact you, to meet you, to talk about your services, about your response when you come to the hospital. Now, this next slide is going to be interesting to some of you. I do hope that you can see it. This is our current SANES in West Virginia. So there's two important things I want you to understand, trained and practicing. We have a lot of nurses in our state who've been trained. What that means is they've taken the 40-hour course. Practicing means those SANES finished all of their clinical hours and now have been signed off to be able to do this work by themselves independently. If you've trained, you've done 40 hours, but you didn't finish your clinicals, you should not be collecting kits. Now, is it happening? Yes. Do we know about it? Yes. All we can do is to encourage hospitals to follow best practice. Best practice means that you finished it, preceptor signed you off, and you are good to go. So look for your county. I don't know, Nikki, if you can make that higher or not. If it's a white number, that tells you how many nurses in your county have been trained. If it's a red number, it tells you how many, as of 2 months ago, were practicing. And if there's nothing in your county, we have work to do. If you serve that county, we have work to do. We work with the SAFE Commission, who they're trying really hard to get the county plans to paper. Some of you have heard about that. Some counties don't have the opportunity to have a hospital to work with, and some counties don't have the opportunity to have the resources to do a SANE program, and we understand that. And that's why we're doing ED visits, and we're asking folks to come to the table, much like Casey talked about. Talk about how you'll provide those services. Do you need an MOU with another county? We've provided all kinds of templates and have resources available to assist in that direction. So our SANE faculty, one of their key goals is to develop at least 4 new SANE programs before the end of the year. So we want you to know more. And the only way you're going to know more is if you ask about any and all of these things. These are some of the key things that continue to come up about non-report, direct submission, informed consent, your role as an advocate and the SANE's role, who handles the evidence, the timeframes for a medical forensic exam. There seems to be some conversation on the street that we've moved to 120 hours. That is not what West Virginia is doing. We are still in that 96 window. Signs of strangulation, critically important. We've seen a rise in strangulation. We're going to be offering a training for you in September. And so the last piece, and I want to make sure that we have time for some questions, but we want you to think through everyone's presentation to think about who do you call if things come up. So what if a hospital makes a request to you for a training to talk about SANE program development? Is that in your lane? Do you know enough about it? Or should you call me or one of our SANE coordinators to join you to make sure that you have all the right information? What happens if you have concerns about the way your client was handled by a medical provider? Adrian is your go-to. Christina could be your go-to. I could be your go-to, and or the SANE nurses. Some of these things you can't take care of yourself. Remember, it takes a village. We want people to come to the table, understand, we want to educate them, but we really do want to advocate for your client, the SANE's patients. What if your SART team wants to talk about getting a SANE program started? Invite us to come. We can help you do that. So the whole purpose is to remember there are people on FRIS staff who are here to help make your job easier. We don't provide direct services, but we do provide training, technical assistance in all of the ways that you heard today. Lots of information for you. And again, thank you for your time, your attention and hope that there's something that you'll take away that will be helpful to you as you begin your work, either starting it or learning more as we go. Thank you.
Thank you, Debbie. And I want to ask folks as we lean towards wrapping up, if you'll put in the chat one thing that was new to you today. One thing that was new to you today.
Or unmute and tell us.
Debbie shared some stuff. You might even have to look up. The first time I heard preceptor, I was like, I don't know what that is.